Now, using our 3 steps, let's break this down. This question's asking for instructions to provide for the key problem: asthma, patients taking albuterol and beclomethasone. So, let the name of the drug help you guys. So, before we look at the options, we're thinking albuterol is the first drug for brutal asthma attack. It's really the first drug as a rescue inhaler that we use for any type of asthma attack. So it's used before a steroid to open up the airway, and then the steroid powder can get down to the lower parts and base of the lungs. And then zone for beclomethasone is a steroid, and the biggest side effect for that is serious infections. So we teach the patient to wash the mouth, never swallow, because steroids can lead to that serious infection. And any type of steroid can increase the sugar in the body. So hyperglycemia here. So the solution we're looking for is teaching to provide this patient with these medications. Option number 1 would be correct, because albuterol is the first rescue drug or rescue medication for brutal asthma attack. And option 2 and 3 are pretty tricky, so listen close. So option 2 is incorrect because we rinse and spit out the water after steroid use. We never swallow the water. And option 3, steroids, not rescue inhalers. Guys, only one rescue inhaler. Buterols are for brutal asthma here. And option 4 and 5 here are correct. Albuterol inhalers are only to be washed 1 time a week, and steroid inhalers are to be washed daily because of that increase in infection risk. So remember, steroid inhalers go right in the sink every single day. And lastly, option number 6 is incorrect. We never skip the use of steroids even if albuterol works. Both are useful to help the lungs, but steroids act slower to soothe long term. So we always give steroids after albuterol works. Okay, that wraps it up. For more details, now using our 3 steps, let's break this down. This question is asking how to advise a patient with the key problem, chronic arthritis and exacerbative bronchitis, reviewing all this list of medication. So before looking at the options, we're thinking, guys, this is a lot of drugs. So the best NCLEX tip I can give you is always think of 2 things about the worst thing that can happen when the patient's on this drug. So the 2 biggest adverse effects. So levoalbuterol is a beta-2 agonist that opens the lungs and amps up the heart rate. We're talking tachycardia as well as tremors and a little bit of anxiety. So remember, buterols are the first drug for brutal asthma. Now next you have prednisolone. So this is a steroid that sounds a lot like prednisone. So just think S for steroids, S for serious infections, as well as sugar can be increased here. And the next one is an NSAID here, so celecoxib. Guys, remember, NSAIDs are not good for the entire body, and NSAIDs are not good for asthma here. And the last one is ipratropium, which is an anticholinergic. So just think tropium, you can't pee with them. So it dries out the body, and really not good for anyone who has urinary retention or even glaucoma. So the solution we're looking for are instructions to provide this patient. Now, all the options are correct here. So option number 1 is correct. We never stop steroids suddenly because adrenal damage can happen. We never stop hormones suddenly at all, always taper off. Now, option number 2, tropiums are not rescue inhalers. Remember, buterols are for brutal asthma. Then we give tropium and steroids as like the sidekicks. Remember, albuterol, always that first drug during an asthma attack. Now, option 3, yes, capsules cannot be swallowed here. You have to put inside the inhaler for tropiums, crush it, and then inhale. Never swallow the capsules. And option 4, aspirin is an NSAID, which is not good for the entire body. specifically asthma here. So remember, NSAIDs are not good for the body. And option 5 is also an NSAID too. So remember, not good for asthma. So it shouldn't be taken if the patient has an asthma attack. It can worsen the asthma. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question is asking for incorrect patient statements regarding the key problem, rifampin, for tuberculosis. Now, before looking at the options, we're thinking rifampin is a TB antibiotic which stains the body fluids. So the memory trick we use is rifampin, just think red fampin or reef fampin. Just like a red coral reef that turns the body fluids orange and red, which is completely normal. Now, we teach the patients not to wear contacts. So just think, we use goggles when we go scuba diving, when we're scuba diving for a red reef. Guys, we're just using glasses, kind of like goggles, not the contacts. And it's not normal for the patient to turn jaundice. Really, we're thinking about liver toxicity here. And lastly, we use non-hormonal birth control because it can be effective as well. Now, the solution we're looking for are incorrect patient statements regarding this rifampin. So option number 1 is incorrect here because we're looking for the wrong statements. The medication should be taken with food. And option number 2 we have to choose because it's an incorrect statement. The antibiotic decreases the effectiveness of birth control. So just think, if someone's scuba diving with a reef or rifampin, they should basically be on an effective birth control or non-hormonal birth control. And option 3 and 4, the medication can discolor body fluids. And option 4, labs need to be monitored for liver toxicity while on this medication. So we have to choose option number 2 as the most correct. Okay, that wraps it up. For more details and test tips, now, using our 3 steps, let's break this down. This question is asking for prescriptions to question regarding the key problem. You're reviewing a MAR. So before looking at the options, I'm already thinking anything that is incorrect, unsafe, or even incomplete. Now, the big NCLEX tip that we always give is, guys, you don't have to know every single drug in the option here. Just look and see which ones you know, so you can use process of elimination. So the solution we're looking for are medications that should not be admitted or not be given to the patient. So option number 1 is incorrect because albuterol is appropriate for bronchitis. Remember, albuterol is a bronchodilator. So for bronchitis, it's good. Now, option number 2, that's correct. We have to choose it because it shouldn't be given. Remember, acetylcysteine helps to loosen secretions, and it's not a first-line drug for asthma. So remember, albuterol is the first-line drug for brutal asthma attack. So remember, buterols is for brutal asthma, always given as a rescue inhaler. Now, option 3 and 4 are incorrect here. Technically, in option 3, this medication should be given through a central line. It's appropriate for this patient with cancer. And option 4, prednisone is appropriate for a patient with emphysema. So just remember, zone is a steroid, like the steroid helping with a patient with COPD, that chronic obstructive pulmonary disease. So remember, steroids soothe the body and it decreases inflammation. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question is asking for expected findings for the key problem, theophylline level of 32. So So immediately we have to think the max range for theophylline is 20. We're thinking very toxic. The heart is racing because theophylline has ephylline amped up. So the memory trick we use is the 3T's of theophylline. So T for toxicity over 20. That's the key number there. And then the next T is for tonic-clonic seizures, the number one priority that indicates massive toxicity. And the last T is for tachycardia as well as dysrhythmias. So just remember, theophylline has ephylline a little bit amped up. So the solution we're looking for is priority manifestations for theophylline toxicity. Option number 1 is incorrect here. Gingival dysplasia is not a sign and symptom of theophylline toxicity. So just think phylline has ephylline amped up and crazy. Now, option 2 is correct. Seizures is the number one priority. Theophylline toxic here. Now, option 3 and 4, incorrect. Rapid shallow breathing is not a sign and symptom of theophylline toxicity. And option number 4, guys, upper abdominal pain, again, not a side effect. So option 2 would be our most correct one here. Okay, that wraps it up. For more details and tests, now using our 3 steps, let's break this down. This question is asking for expected side effects regarding the key problem, the use of